for HIV identification and prevention and treatment services. And thank you all for coming tonight. It's great to see so many people here and for your interest in our session, Mobile Phones for HIV Identification, Prevention, and Treatment. So before we really get started, I want everybody to take out your phones and turn the volume on your ringers on high so that if anybody gets a call, we can all hear. Actually, I'm just kidding, it's just the opposite. But yeah, please put your ringers on vibrate. I'm sure you all do that as a matter of course these days. We'd like to thank, of course, the National Institute of Mental Health for support of our center, and the UCLA AIDS Institute, the CFAR, also for supporting organizing of this satellite session. So I had hoped to have one of our computer science colleagues give the kind of opening remarks here and give an overview. So I'm kind of borrowing some of her slides from Deborah Estrin, who's been one of our key collaborators over the last 4 years on developing an mHealth initiative for HIV prevention. And so this slide comes from Deborah, and it's basically an overview of mHealth. I know some people may not have heard of mHealth, or it might be kind of new to them. But the basic definition would be the use of mobile devices to enhance health and wellness by extending health interventions and research beyond the reach of traditional care. And so we can kind of follow the slide starting from our actions or our states, our behaviors, our symptoms, which we can also provide self-reports on. And that data can get processed into what we might call a personal data repository, can be processed in the cloud, and then aggregated, sort of analyzed in real time, fed back to users, to clinicians, and to researchers as visualizations. And then that can be fed back to the individual users at multiple levels. So sometimes we kind of come at it from a perspective of the patient as the person of interest, but this can be anybody's behaviors, patient behaviors, healthcare providers' behaviors, and even healthcare systems behaviors. And it's not just a mobile app, so it's actually data analysis and sense making are as critical as the data capture. Because so much data can be captured through mobile devices, we can be absolutely overwhelmed and swimming in data. So we need to be thinking about designing analytics and visualizations that make the data easy to use and digest and process and understand from the get-go. And that is often fed back through end user dashboards is one way we can think about it. That might be on the computer, but it also might be on the phone, which we'll demonstrate a little later. We can aggregate that data up as to something that might be called researcher dashboards or even service provider dashboards. We can get population statistics, we can track participation in our studies or in our interventions, and we can even create surveys or create protocol prompt tools through simple user interfaces that we can provide on the web. And again, as I mentioned, it's not just for personal behaviors, it's also for fidelity support and monitoring for intervention deliverers. And this is a slide from Mobenzi's website that I just love. It shows a PMTCT protocol from one of our collaborative projects for community health workers. And also from Mobenzi, I love this slide, so you can also see demagi.com, another one of our collaborators, for similar ideas. This data forms an mHealth data ecosystem. And you can see at the bottom of the slide on the lower left, we have data collectors and community health workers, could be other health workers or interventionists, and also we could add in there users and patients or clients, can provide data through their mobile phones, and that can be processed up to researchers, to managers, to staff supervisors, and fed back through web browsers, fed back through phones, and it can kind of bring this whole feedback loop to multiple users across this kind of data ecosystem. So essentially what we're trying to do is think about data-driven feedback loops at multiple levels. Participant self-care at the kind of most micro level, then clinical care, clinician care, and then aggregating up to research evidence. So this is kind of the very brief and grand vision for how mHealth tools can kind of bring research and data and evidence from the individual patient or client at one end all the way up to health systems at the other, and do it in real time without the burden of paper, data entry, and the costs associated with that, which have made this kind of process of monitoring and support really costly up until now.